Today you may have heard there was a anti-vaping summit held at the White House. But here's the things that you didn't hear and that you should know no matter if you are a vapor, a smoker, or even involved in it at all, because this affects everyone. Most of you have probably seen or heard the news of people getting sick or dying, supposedly of vaping. You've probably heard some state senators and even the president, like today, weigh in on what's going on with this vaping ban. No matter if you think this should be banned or if you don't really care, this is very important. Every state makes money off of people smoking through various ways. We all know of the taxed way, but there's a bigger way that most people don't know about. In 1998, they had a big settlement between all of our states and the big tobacco companies, which was a good thing. You know, states were losing a lot of money when people were getting sick and having to go on Medicare, Medicaid due to secondhand smoke, lung cancer, COPD, and all of these other things. This money would be a percentage of the profits that the tobacco companies would make every single year forever. Pretty sweet deal if you ask me. But it's understandable if that's what was really going to happen, because the deal was that they would use this money for things like smoking cessation programs, getting people to quit smoking, and healthcare, and things that have to do with smoking. You know, some of these states didn't really want to wait around every single year to get this lump sum of a few $100 million every single year. And so what did they do? They sold bonds to Wall Street, kind of like a payday loan. And they got themselves in a bit of a pickle. They are building golf courses, shipping docks, campaigns, just essentially anything that they want. It's essentially a blank check. So who wouldn't want this money, right? Well, what they didn't see was vaping coming into play, which hit them in their little pocketbooks. From 1998 till now, smoking has decreased by 50%. Yes, 50%. You would think that smoking cessation programs would be absolutely ecstatic about such an accomplishment because it's amazing. Adolescent smoking rates at an all-time low, adult smoking rates at an all-time low. So what's causing this, and why are people saying this is bad? This is bad for who? The customer? The children? No, this is bad for our state governments because they spent the money they didn't have. Not all of the states, but one state in particular caught my eye, and that is Utah. Why? Because Mitt Romney is the one that was the cosign for this anti-vaping, trying to get it banned, right? They have received over $7 million over the last 20 years. And just this year alone, they have received $110 million from this MSA. Well, this is kind of a big deal. So what are they going to do when they don't have this money to try to help people quit smoking? They don't have another option. So what do they want to do? They want you to start smoking again. Does this have anything to do with the children? Absolutely not. How do we know that? Because of the research. The research is clear. And even countries in the UK and all over the world are actually using vaping to help people stop smoking. They have many studies done by very prominent colleges that have proved that vaping is not dangerous. So what happened with these people that supposedly died? Well, first of all, there's only been a couple of them. Let's even go with 100. 100 people out of the country died. But what did they die from? Well, in every single case, it was black market vaping juice, meaning they made it themselves at home. And in almost every single case, it had to do with THC. So we don't know what really happened. Did they mix something bad? Were they taking other drugs? We don't know. And I'm not going to make that assertion, but it's been like 100 people. When we have 450,000 people every single year dying of smoking, and we have 41,000 people dying of secondhand smoke every single year in our country. But this is the big... Some amazing research just came out after I recorded this video, proving that vitamin E acetate is confirmed to be the key culprit that is causing these lung diseases, illnesses, the pneumonia in these patients. This is only found in cannabis type vaping, not normal vaping, and not all of the cannabis ones. But it's also found with some black market ones, that meaning what you make at home, like I said. But you have to watch out because they're still trying to leave out that key part of it being from the cannabis mixture where they're using that vitamin E acetate. But this is proven fact. This is what's going on. So what's going on here is these states are only spending about 7 to 10% of this few $100 million they're getting every year on actual smoking cessation programs or healthcare. They're using it to their heart's desire. Even for these states that have not overextended themselves with these bonds, they're still in trouble because, and I'm saying monetarily they're in trouble because they're using this money to fund other situations, whatever the case may be, golf courses and whatnot. And due to this massive decline and the loss of revenue throughout these states, it could make these state legislators easy targets for certain lobbying groups to convince them that vaping is dangerous. So I'm not faulting anybody, I just don't feel that they are doing their research, and money is a large factor in that. So who are these lobbyists that are whispering in our state and legislators' ears?
Household names like the Campaign for Tobacco-Free Kids, Truth Initiative, American Cancer Society, American Lung Association, and others are viewed as trustworthy promoters of evidence-based policy, but they rely on funding from the government, private foundations, tobacco taxes, and the MSA. These health advocacy groups appear to be at the center of a complicated web of money and influence. These groups, often referred to as tobacco control groups, require funding to survive, like all nonprofits. But the key difference with tobacco control groups is they want to appear as unbiased health authorities, with only the public's health being their primary concern. In order to maintain that image, they are somewhat limited in what funding they can accept, so many of them wind up relying heavily on government funding. In order to secure that funding, they have to make themselves an invaluable asset to the government, and they do that by lobbying on behalf of the government, something the government itself cannot legally do. The government ends up endorsing and funding these tobacco control groups, and in turn, they work together to legally execute their shared political agendas. On the Campaign for Tobacco-Free Kids website, it reads, "The Campaign for Tobacco-Free Kids works to ensure that the CDC's life-saving tobacco control programs are fully funded by Congress." This symbiosis occurs both at the federal level with organizations like the Centers for Disease Control, as well as the state and local level. This is why you often see these groups at legislative hearings testifying in support of increased regulation, taxes, and bans on smoking and vaping. Two of the most vocal groups against vaping are the Campaign for Tobacco-Free Kids and the Truth Initiative. The president of Tobacco-Free Kids, Matt Myers, was instrumental in negotiating the MSA, which gave the states billions of dollars in additional funding. The Truth Initiative was created with MSA funds and is seemingly beholden to Myers and follows his lead on strategy and messaging. Consider that for a minute. The guy who negotiated the MSA came out of it with an additional squeaky clean nonprofit that would support his own agenda, an agenda that centers around making sure the MSA money is spent on organizations like his. Tobacco Free Kids states it does not accept government funding. However, the nonprofit was created by and runs on grants from a private foundation called the Robert Wood Johnson Foundation. This foundation is run by individuals from the CDC and FDA, works closely with and funds projects for the CDC Foundation, as well as the Department of Health and Human Services. So while it's technically true that Tobacco Free Kids does not accept government funding, the source of their funding is very cozy with the government. The Robert Wood Johnson Foundation also supplies funding to the American Cancer Society and American Heart Association, who also fund tobacco-free kids, as well as the American Lung Association. These organizations team up together on projects that have included pressuring and suing the FDA for delaying e-cigarette regulatory deadlines and vilifying the vaping industry publicly. The weight of all of them together is often too persuasive for media outlets and legislators to bother questioning. Now that we understand the ties that bind all these organizations together, let's examine their reasons for trying to unravel the vaping industry. Tobacco control groups promote prevention through abstinence-only education. But since quit or die isn't a very catchy or compassionate sounding message, these groups rely on other arguments instead. Dangers to children and unknown long-term health effects are historically the most common arguments. I'll need entirely separate videos to address those. However, their most recent tactic has been conflating lung injuries and deaths linked to black market cannabis products with commercially available nicotine vaping products, resulting in panic and irrational statewide bans on all vapor products. There is a genuine concern, even at the FDA, that such sudden removal of vapor products from the market will result in many vapors going back to smoking. Why would health groups want people to smoke again? While the purported goal of these tobacco control groups is to eliminate smoking, they've also made that task impossible by deliberately orchestrating and persuading state governments to rely on tobacco money as a source of state revenue. The simple truth is that if smoking were eradicated, tobacco control groups would be out of a job.
So they make sure and walk that fine line of ensuring that they are looking like they want you to quit smoking, but not too well that you actually quit smoking. So what better way to essentially stay ahead of the curve by demonizing and vilifying another group that they could start shelling in money from? So their whole situation right now might not be to actually ban vaping right now, but what they're doing is planting the seed, just like they did with tobacco. We all remember the big tobacco stuff. People didn't quit smoking, they kept doing it. It was on them. There's a difference. Secondhand smoke actually does hurt people. And vaping in itself doesn't seem to be causing any real life-threatening issues. So what better way but plant these seeds to say that there is some type of epidemic that is a danger to children? This occurs with everything. It's money, and they use the children. It's sad, but it's true. But as long as you are educated, you can combat yourself and arm yourself with the truth, the actual information, so you can stand up for these erroneous charges and these erroneous situations that, yes, it might be vaping today, but it might be your glass of wine next week. It might be, heck, whatever your favorite thing is, fishing. People die from fishing or hunting. It could be anything. Anything that they're going to continue making money from. And if nobody's going to stop them, they're going to continue doing it. It's a absolutely abhorrent way to run any type of nonprofit health organization. I worked in the emergency room as a registered nurse for many years, and I've seen the shadiness that goes on with certain insurance filings and things like that, and how the government essentially just pays out anything that they're just asked to do. And so they would much rather answer to any type of government entity than any type of private company that's actually going to say, hold on, let me check the data, because it's going to hurt their bottom line. We all know that the government will overly extend themselves on anything in order to get that next vote. But what you need to realize is this isn't just about smoking, vaping, or anything. It's so much bigger. It's about the rampant corruption that has plagued DC for decades. And when nobody is holding them accountable, this will continue. This unfortunately even goes on with our education system. The report cards just came out for the country, and it is one of the most terrible report cards that the country has ever had in education. But yet they're still going to continue shelling out all of this money for frivolous things that are not even working. Why? Somebody's getting the back end of that. And it's so they use the children, then they don't care about the children. As sad as it is, powerful people in the US, mainly our government and anyone tied to it, find that if people don't quit smoking, it's because they didn't try hard enough. And so it's okay to make money off of them, right? That's what we're okaying. We're allowing them to use this federally funded money, and well, money that's supposed to go to health programs, which could help improve lunches at school or build sidewalks. I mean, I feel that that would be a lot better than creating private golf courses or other frivolous things. But we don't hold them accountable. So many of us sit around and say, the government's corrupt, what can I do? What you can do is stand up and no longer allow this. Speak out at every time that you have a moment. Stop being afraid to speak out about issues that not only affect you, but that affect your children and then your children's children. They affect your entire community. Could you imagine if they had been spending these millions, hundreds of millions of dollars in the correct way after all of these years? How much different things could be? I mean, you know, that money's gone. But what we can do is no longer allow them to continue doing this. No longer saying, well, it's the R or the D. It's the best of two evils. The best of two evils is still evil. And in my mind, DC needs to be completely eradicated because they are not doing anything that is helping the American people. That goes across the board. We have state and local governments for a reason. Our founding fathers put it in our Constitution to have a 9th and 10th Amendment for a reason. The only reason for Washington, D.C. was originally for foreign affairs, essentially. It was essentially an administration position. Your governor was the most powerful, essentially the most powerful person. But what has happened? After many years of essentially allowing this to occur, our governors and our local legislation has just sold out to the federal government for money. And you are not powerless. We can do something together. But you have to just start. Start by sharing this. Start by looking at what your local and state governments are doing. Stop worrying about DC. It is a circus. If you have not seen my couple of videos before this where I spoke about the impeachment circus, you should probably check that out because you will probably be outraged. I'll actually put it at the end of this video. So again, this isn't just about vaping. This is not just about smoking. This is about so many other things. And of course, they're not going to tell you about these things. But these are the important things. When are we going to say enough is enough? It's not R versus D. It is us versus them. They don't have the power. We have the power. But they know that we have been in that mindset of what can I do for so many years. that they don't think that anybody's going to do anything. I've said this many times in my videos. There's one thing that these corporate elite, government elite people are afraid of. Just one thing. That's unity. Unity among the people. Among me, you, no matter what side of the aisle you think you sit on, there's really only one aisle. And that's the bottom of the aisle, essentially. So what are you going to do next? Hopefully you will like, share, and subscribe. And we can start to make a better community for our children, for ourselves, and no longer feel hopeless, because we're not hopeless. We are very powerful. You'll have a wonderful night. Like, share, and subscribe.